With Paxlovid treatment for COVID, we have a new and ongoing issue, and that is that doctors are refusing to prescribe Paxlovid for people that are actually eligible to receive it, which, in my opinion, is gross medical negligence. Or, as I read in an article, anti-paxers, where some doctors are saying that they're not going to prescribe Paxlovid because the person wasn't immunocompromised, or that they wouldn't have been able to receive it if they didn't have asthma, that Paxlovid should only be given for near-death individuals, that they weren't sick enough, weren't disabled enough, or pretended that the only available treatment was something like ivermectin, which we know doesn't work. And people are being forced to go through this process to get it prescribed multiple times. So let's go through the FDA and CDC recommendations for Paxlovid pertaining to the United States, and this is accurate as of December 25th, 2023. So first, right off the bat, when we go to the FDA, Paxlovid is indicated for the treatment of mild to moderate coronavirus disease. Note, not for severe disease, so when you're seeing statements like this that you have to be near death to get it, or that you aren't sick enough, that's literally not what the Paxlovid is for. It is for the mild and moderate courses of the disease. And then for quote-unquote high-risk factors, which would include being elderly and other underlying medical conditions. So this example where the individual was denied is pretty appalling because they have two risk factors. They're over 50 and they have another coexisting morbidity, a coexisting condition, COPD. And that statement for high risk is not to be a blanket for just immunocompromised individuals. They even define it, where high risk can include things like diabetes, heart conditions, being a former smoker, having obesity, being of a marginalized group such as a racial or ethnic minority, having lack of insurance, transportation, childcare, and the ability to get off of work, people that are unvaccinated or not up to date on their COVID vaccines. And all of these would be considered high-risk factors. And to be abundantly clear from the CDC recommendations, the U.S. Food and Drug Administration, the FDA, has issued an emergency use authorization to make Paxlovid available for treatment of mild to moderate COVID in adults and children 12 years of age and older weighing at least 88 pounds or 40 kilograms. So if you meet any and all of those criteria, you can get Paxlovid. It can and should be prescribed to you. It should not be denied to you. And there are a few conditions, such as having contraindications or dairy allergies, or existing medications that you're on that you can't be discontinued or that have a bad effect when combined with Paxlovid, and I'll go over those real quick. This is not an exhaustive list, but these are some of the ones that can have negative impacts with with Paxlovid. But those are all ones that can be discontinued temporarily while you take Paxlovid. So these are ones that are okay, just make sure you're not taking those while you're on Paxlovid. But there are some drugs that if you're on them, you cannot discontinue them and then immediately start Paxlovid. And these include things like anti-cancer drugs and cystic fibrosis treatment. Additionally, there's not enough data on pregnancy and lactation and taking Paxlovid, in addition to people taking contraceptives. My partner had to stop taking her birth control during her Paxlovid usage because of this. And there's no established dose for pediatric patients, so that's why that under 12, they don't have a recommendation. Which brings up the question, well, what other treatments are there outside of Paxlovid? Well, there's Veklury, which is approved for adults and children. And here's a little table from the CDC breakdown, where if you can't get Paxlovid, there's also that Veklury, which is for adults and children. And then there's also Legvrio. So these are some other options that are could possibly be taken outside of Paxlovid, just for awareness. But if you get denied, you should know that these are things that you should be able to get to be prescribed. You should know that your doctor, if they're denying you without any of the valid reasons for not prescribing the Paxlovid, if they are just saying you're not sick enough, things like that, know that that's directly against the FDA and CDC guidance, that they're essentially speaking out of their buttholes, and that there are at least 3 different options to get around it. So you can go to an urgent care and they can prescribe you Paxlovid. Some pharmacists will prescribe you Paxlovid. You can do a telehealth appointment through your primary care physician. And then there is the Test to Treat program at testtotreat.org. These are all options for getting Paxlovid.